Hello guys, hello, happy hump day. All right, I'm looking really white right now, but that's okay because that's not what this is even about. But welcome to my Detox and Dental Talk. So while people jump on, if you catch this live, drop a 1. Catch the and you'll know if you're live, there'll be a red box up here. Catch the replay, drop a 2. And if you share this, tell me so I can say thank you. And honestly, I would share this with anybody who breathes, because tonight this is going to be more than just teeth talk. This is actually going to be something, the consequences of sleep apnea. So while people jump on, tell me where you're watching from. Tell me if this is your first time to watch one. Say I'm new, and oh man, and then I'm gonna get my mask on. So hopefully it's your night to mask as well. This particular mask, guys, you can detox your armpits if you got the stanky pits. No, even if they're not stinky, you can detox your pits. I just exfoliated first, so I'm detoxing now. And you can actually even do like the bottom of your feet, like the heels, if you have like cracked feet. Nobody even has to know you're doing it. Hey guys, hey Shannon, hey Lindsay, hey Jocelyn, happy Wednesday. I know it's kind of early, but Brandon is bathing Corbin, so I'm gonna hurry and get this out of the way so I can have my wine and possibly even go to bed even earlier tonight than last night. I took NyQuil last night and it was so nice. But it was still in my system when I woke up this morning, so that was hard to get out of bed. I have a grateful book. I write things I'm grateful for in every day. One thing I'm grateful for, my goal is to do it for a year. Because it's nice to remember the things we're grateful for, right? Okay, so we're going to talk about sleep. Hey, Alejandra. Hey, Sierra. Hopefully y'all caught my burst. I know it's a lot of dental stuff right now. It's one of my passions, as you know. If you don't know me, I am a dental hygienist. I do all kinds of crazy things on this page, so make sure you touch my bubbling face. And it says following so you don't miss it. If you watched my live last night, you saw me show off my newest favorite toothbrush, and a lot of y'all snagged it. Can't wait to see what y'all think about it. So, I printed out this thing. So if you go to doctor's offices, I took Corbin to his ENT last week. So somebody tell me when it's been 7 minutes so I can get off here and wash my face off. But there was a picture on sleep apnea. It's like an untalked about thing. It's a little more common than it used to be as far as talked about, but a lot of people don't want to hear about it. They don't want to believe that they have it. But as a hygienist, we see early signs of it because of the things it does to your teeth. Or when you're laying back, we can tell how your tongue relaxes into your throat. Oh, Jenica, no. So sleep apnea is serious. It's very serious. It affects 1 in every 5 Americans. Okay. So I'm going to read off some stats from on sleep apnea that I printed off. Y'all, I am truly a science nerd. I love all things factual. It's my green personality. He was only 57. Oh my God, did his heart just stop? Or did he stop breathing? People do not know how serious. It's a true story. My dad, the lady when he did his, and if my dad can go in for a test and wear a CPAP and be compliant, anybody can. Very loud snore. Anybody who snores, that means your airway's being blocked, basically, okay? If you're a consistent snorer, not if you're like hammered or if you're sinus infection or something, but a consistent snore, whether it's loud or not, your airway is being semi-blocked, and you have to have something to help you open that. If you have like a larger neck circumference. But, okay, so we're just gonna start from the top of the head and work our way down. 90% are higher risk to have strokes. Men with moderate to severe sleep apnea are nearly 3 times more likely to have a stroke. Sleep apnea is often found in patients following a stroke, and the risk of stroke arises with the severity of the disease. Hey Jody, hey Mariana. Okay, now basically if someone has poor sleep, like they're like, man, I don't sleep good, blah, blah. So when you have poor sleep, when you have sleep apnea, you get poor sleep, okay? 58% of those people have mood disturbances like depression, anxiety, loss of motivation, shortened attention spans, moodiness, bad temper, poor judgment. Hence why a lot of moms have these things, guys. Give moms a break because they usually are getting poor sleep. No, just kidding. Thank you for telling me it's already been 5 minutes. Holy moly. I'm going to have to keep this mask on for like 20. Don't judge. 87% of people that have poor night sleep have daytime sleepiness. There's a 6-fold increased risk of car accidents when you have sleep apnea. Impaired concentration and memory loss, reduced work efficiency, and reduced alertness, so you have slower reaction time, okay? Now, that's all mental stuff, right? All brain, head stuff. Let's move down to where you're like into your throat, okay? 80% of people with sleep apnea have loud snoring, which can cause relationship discord. It can cause morning headaches because you've been deprived of oxygen, right? So if you wake up with a headache. Also, in the oral, let's move back to the head. If you're a grinder, if you have signs of severe wear on your teeth, and you snore, those are 2 top signs of sleep apnea, okay? Because usually grinding is you're trying to find a way to open up that airway, okay? Sleep apnea, let's move down to the heart. There's stress on the heart, okay? This is a huge one. Stress on the heart, 77% of people have hypertension. Sleep apnea is an identifiable cause of high blood pressure. It's also the leading cause of secondary hypertension. Hey, Chrissy. 25% of people have coronary artery disease. 58% cardiac arrhythmias. 4 times as likely to have atrial fibrillation. 76% of people have congestive heart failure. Moderate sleep apnea have increased mortality rates. Most people with congestive heart failure that are new patients to it are screened for sleep apnea. 38% higher risk of heart disease and 30% sudden death. Sleep apnea sufferers have a 30% higher risk of a heart attack or premature death. 30%, y'all. That's crazy. And more than 50% of sudden deaths from sleep apnea occur between 10 p.m. and 6 a.m. Just a little fun fact there. Okay, we're gonna move lower into like the gut system, okay? 15% higher risk for diabetes type 2 because lack of insulin control and poorly controlled blood sugars. 58% of people with diabetes type 2 have sleep apnea. Also moving down, 61% higher have obesity. As sleep shortens or diminishes in quality, appetite for high-calorie food increases. Obesity is the best documented risk factor for sleep apnea. It is estimated that 90% of obese males and 50% of obese females have sleep apnea. The prevalence of sleep apnea increases with your BMI, your body mass index. Approximately 80% of sleep apnea patients weigh 130% or more of their ideal body weight. Okay? And then 60% of people have GERD, which is gastroesophageal reflux disease, whatever. Gastroesophageal, I am awful with those words. Hey, Mom. Hey, Court. Okay, now we're moving further down to like the groinish area. 80% of middle-aged men have sexual dysfunction because loss of libido and impotence from sleep apnea. And 48% have nocturia, which is frequent urination at night. And last thing I'm going to leave y'all with before this becomes permanent, medical costs. Untreated sleep apnea costs American an extra $4.3 billion a year. And treated sleep apnea can half a patient's healthcare costs. Because think about it, if you're treating the sleep apnea, you're probably treating a lot of other unknown things or a lot of things that you're buying medicines for or seeing doctors for. So change in annual healthcare costs per patient after treating sleep apnea is around $200,000 for sleep apnea. So what I want to talk about in the dental world with sleep apnea is we have a lot of patients that are CPAP intolerant, meaning they don't like the way it feels, they can't sleep on it, it dries them out, they're not comfortable. all the people who have CPAPs that love them say they're life-changing. But for those that are not compliant, there's different ways, and there's dental appliances that can help with the same thing. So I'm just gonna show a few different ways, and I'll show the most common one we use in our office. And I'm so gracious that my office lets me show these things. So this is one. It's a two-piece. It's almost like two night guards, and it slides in, but these side pieces stop you. They catch onto the orange connect, and they stop you wherever your opening is to allow that airway in, okay? So this is one form of a dental sleep appliance, okay? Let me show some more. There's all different kinds, guys. There is, I got tested whenever we went to a class on this, a 2-day class at the dental school when I was pregnant. And even like, I don't snore at all, but even I had like a slight closure, which they said is sometimes common in pregnant women. But here's another one. It's just like a top and bottom mouthpiece, okay? That you would put in your mouth like this. And it's designed to open however you need, whatever your degree is that you need open. I know some people use a night guard and they even have good results with just the night guard helping them a little bit. So then there's one like this, okay, that has these on the side, which if you're a clincher or grinder, this is a little more ideal because it still gives you that movement, because you're still gonna grind your teeth. If you're a grinder, regardless what you have in your mouth, you're still gonna make that movement. There's no way to stop the movement. You can protect your teeth and keep your airway open still with something like this, okay? And everything foreign in the mouth is going to take time to get used to, guys, whether it's a night guard, a sleep appliance, whatever. But if it's your health and you feel good and everything else, it's worth it, okay? So all you hard-headed people out there. All right, here's the last one. This is the one of the most common that we use in our office. It's clear, but it kind of looks like the same thing I showed you. See, it still gives you room to like grind or like clench your teeth, but it protects you, and it also opens you. These things are different per each person, so it opens you however much you need to be able to have that airway to breathe. So CPAP ideally is the best if you need a CPAP, and that's what they tell you. But if you just truly cannot use it, there are dental appliances for sleep apnea, guys. But take sleep apnea serious. If somebody tells you about it, the reason dental looks for it is because we see you a little bit more than doctors. Most people only go to the doctor when they have a symptom. A symptom is the last sign of an illness. We usually see people on a more routine basis, so we can catch signs and symptoms that's early, like an oral cancer and sleep apnea, diabetes, all kinds of stuff your dentist and your dental office can pick up on. So anyways, that's what I wanted to talk to you about tonight, because sleep apnea is super serious, but it's not taken as serious as it should be. If Jenica's still on, she even wrote on here, her dad passed away at 57 suddenly from sleep apnea. You don't want that to be you or somebody you know. Okay, so I'm gonna leave you with that so I can take this off and finish the rest of my nighttime routine. Thank you for jumping on with me. Don't forget to click my face, touch my face, and make sure it says following so you don't miss any of my whatever videos I'm gonna show that day. You never know what you're gonna get. I had one of my girls tell me that last night. She's like, I love watching you. Never know what you're gonna say. You're so right. And last night you probably caught my dental brush thing. I know we're talking a lot about dental this week, but anyways, it's a passion of mine, and everybody with teeth or without teeth or a body should care about their health, right? All right, guys, love y'all. Happy Wednesday.